G4A. They have quite a healthy kind of incubator and accelerator based out of Berlin, but also around the world. Many centers now being set up. They offer, for startups, certainly a package of funding as well as using it for the wide ecosystem of Bayer. And of course, Bayer are huge in Germany and other parts of the world. So please do collaborate with Sophie and just shoot a message to her if necessary, or the team. So look, in terms of the interactivity here, we do have some microphones. We have to be careful about sharing it, etc. So we have to make sure that they're clean, we can ask questions, and please, if you want to ask questions at the end of these sessions, raise your hand, and someone will come with a microphone, and we'll clean it afterwards for the next sessions. I think we have 2 microphones per session, so we have to be very careful about the way we manage this conference, and to be very careful about not spreading infection appropriately. So that's why we have to be cognizant of that. So, of course, education, I mentioned earlier at the beginning, is really changing in terms of the way we educate future generations. We've seen virtual learning coming in with Zoom and Microsoft Teams and endless meetings, of course, and really disrupting what was there before from face-to-face. Health Education England have been amazing in the last year, really thinking about the future, really forward-thinking organisation. And it's a pleasure to have them here with us today. Of course, Chris Munsch and Martin Sinclair will talk about their thoughts on education and how we go forward. Chris is a fellow surgeon, cardiac surgeon, of course, also has a huge role in education for many years, a passionate driver of change. And Martin is one of the product managers at Health Education England. So I'd love to hear more, Chris. You get a rock star attendance here, then.
This is weird, isn't it?
You got your clicker.
Right, so hello. As Shafi mentioned, I'm Chris Munsch. I'm a formerly cardiac surgeon. Currently, I'm the clinical advisor to the HE-TEL program. I'm going to do a bit of a double act with Martin today, so I'll start and Martin will come along behind. And what we'd like to do is introduce you to Health Education England, for those of you who don't know about it, and particularly what we've been doing in the Technology Enhanced Learning team over the past year or so in particular. So first of all, I don't know how many people know what Health Education England is or does. This rather clunky mission statement here, you can read it for yourselves if you've got the strength, but it does actually remind us that our priority is patient care. So whilst our function is to deliver training and education to the health and care workforce, our purpose is to make sure that patients and citizens and the public get better health care. So that's what Health Education England does. What does Technology Enhanced Learning team do? So we see ourselves kind of as an enabling function for all the other parts of the HE organisation. And we provide other parts of the organisation with technology and technology-based solutions, such as simulation, such as learning platforms, and we'll talk about those all in a minute. So, Technology Enhanced Learning team has essentially 4 main functions. We also cross-pollinate or interact across the Directorate of Digital Innovation and Transformation with things like robotic surgery and AI, but we'll not trouble ourselves too much on those today. So our 4 main functions are simulation and immersive technology. How do we support TEL at regional and national level? Digital learning platforms and educational content, which Martin will talk about when I finish. So let's look at simulation and immersive technology first. Now, simulation has been around as an educational tool in health and care for many, many years, but it has always been a little bit messy, if you know what I mean by that. There's been different approaches in different regions. There's been inequality of provision and inequality of access, which have created a rather unlevel playing field. despite the quality and the usefulness of some of these simulation resources. So a couple of years ago, we brought out some guidance in terms of a framework for how educators might best use simulation-based education in providing training and learning. And that was very well received, but we felt as if we could probably be a little bit more ambitious. And last year, after a lot of wailing and gnashing of teeth, we put together a strategic vision for simulation, recognizing that simulation was not just an educational technique, but it could be used across the whole of the health and care workforce, not only improving patient safety, but for activities such as recruitment, return to work, increasing the ability to deliver training at scale, particularly as we move into this era of blended learning. There's going to be more and more need for training placements done remotely. We're looking at simulation-based research and innovation, learning from other sectors outside health and care, which has been fantastic to bring us into contact with people like Microsoft. And we've learned an enormous amount from the impact of COVID. For example, how to deliver a simulation teaching episode when you can't be in the same room as the people, as your learners. And this vision has included a whole bunch of interesting case studies which you can refer to, and user toolkits so that you can pick things out which you think are going to help with your delivery of education. So that's simulation. Part of simulation increasingly is now immersive technology and extended reality. And you'll find, I think, that people use these two terms interchangeably whilst this sort of semantics settles down a little bit. But immersive technology, including virtual reality, augmented reality, and mixed reality, has the real potential to transform healthcare and healthcare education. And this is a real, it's a really exciting time to be involved in healthcare education as these new toys, if you like, come onto the market. And I use toys very carefully because there is a temptation to be, if you like, beguiled or entranced by the shiny stuff and go out and buy it because you like the look of it or you can play with it, without really addressing what you're using it for. And we've been very firm on this, and I think we've kind of held the ring on this, together with collaborators such as the Leeds Institute of Immersive Technology, in stating 3 principles for the institution of, or the adoption of extended reality. Everything has to be designed and developed with the learning requirements in mind. So it's what's your learning outcome, and can immersive technology help you achieve it? We're going to insist, as we roll this stuff out, that everything is accompanied by rigorous evaluation, not bolted on as an afterthought, but actually built into the design of whatever program you are having. And thirdly, we're going to do something which is probably completely unheard of, but we're going to foster a culture of collaboration so that one region, one region will talk to the other and collaborate with them, and we won't have silos of innovation which don't communicate with each other. This is an example of something we did. This is HoloLens COVID Man. So this is a patient, or an actor actually, but with COVID, and we've sort of superimposed him on a HoloLens situation. So, and you don't have to just do this in a clinical situation. Here you can see it's being done in the patient is appearing suddenly in Richard Price's study. So you can get it out there to thousands and thousands of people, and you don't have to expose them to the risks of a real COVID patient. So that's just one of the sort of pieces of work we've done. Moving forward, what we're really keen to do is to make this stuff available, but in a kind of controlled way. And so we have developed this concept of a virtual extended reality hubs, where we will hold the equipment and we will produce it, or if you like, lend it out like a library to educators who want to use it, and can make a case for using it. And we'll hold their feet to the fire about using keeping the three principles we've articulated in mind. So we have acquired a fair amount of kit. We're holding on to it. People can come and say, I want to borrow your starter pack for 6 months. I've got this in mind, and away you go. So that's the virtual XR hubs. And the reason for doing this is to flatten out this inequality, this variation in inequality, allow people to demonstrate the use of the equipment before they try and persuade the chief executive to buy it. It stops equipment being sat around unused, which is what happened to so much of the high-end simulation kit. And we've got evaluation embedded right from the start. And we hope that we can use some of the lessons we get from this and put them out there into sort of sharing best practice, put them on our learning hub, and Martin's going to talk about the learning hub shortly, and build this sort of capacity and capability of using extended reality within the National Health Service. Of course, none of this works if we just sit in our ivory tower, or our ivory living rooms, or our ivory, home offices. We got to find a way of supporting technology-enhanced learning, both at the regional and national level. And we've done this already in several ways. We have helped develop a rollout of Microsoft Teams, not just for having meetings, but as virtual classrooms for learners. So the day of where all the trainees in a hospital used to pack their bags on a Friday afternoon and go off to another hospital on the other side of town for their teaching can now be done virtually. We're supporting that with a virtual instructor-led learning program. So educators are asked to perhaps rethink how they deliver their training in a virtual world, and also how they use Teams to the best effect. The Topol report, which came out a couple of 3 years ago, was very keen to emphasize the need to turn the UK health and care workforce and make them digitally literate. And we've created a digital literacy framework. We're now in the process actually of creating an artificial intelligence competency framework. And we are going around looking to make sure that all of this can be delivered within the somewhat variable IT environment of the NHS. Not every hospital has the same approach to internet provision and everything. So we've got to make sure you can have some great kit, but if the Wi-Fi's pants, then it just isn't going to work. I think that's enough from me. I think I'm going to hand over to Martin Sinclair, my colleague, who's going to talk about the next two topics.
Thank you, Chris. So, hello everybody, I'm Martin Sinclair. I've worked within the e-learning for healthcare team, part of health education, for a number of years. I'm going to talk to you about some of the digital platforms we have for delivering digital learning content, and also the content creation and curation processes that we have available. So there are three platforms that Health Education England's Technology Enhanced Learning Programme offer. I'm going to go through each of them in turn, but you can see them on screen now. So there's Digital Learning Solutions, the e-learning for healthcare hub, and the Learning Hub as well. So the first of those is the Digital Learning Solutions platform. This recently came over to Health Education England from NHS Digital. They've been established for a number of years, and what Digital Learning Solutions offer is training for the workforce in using IT systems. Now, they may be clinical systems, such as around summary care records. We've also got a huge program called the IT Skills Pathway, which is aimed at enabling the workforce to use just standard office tools, Microsoft Word, Excel. So much of clinical care relies on people being able to do things like this, use these relatively simple tools. And as Chris said, there's a focus on digital literacy within Health Education England with the work being done around the Digital Capabilities Framework and so on. And this IT Skills Pathway, for example, supports people in getting more familiar with those tools, which is so critical for everyday working, really. Another thing that Digital Learning Solutions does is it gives local systems or local organizations, the ability to create their own content tailored to their own systems that they use. So there may be some systems that they have around workforce rostering and that kind of thing, or other ways of kind of managing workforce activity. Digital Learning Solutions gives them a tool to create their own content, explaining how to log in, create a new user, move this person across to that area, and that kind of thing. The ability for that local tailoring gives that sense of empowerment to those local organizations, gives those organizations what they need in their particular time of need and to suit their particular situation. Related to that, and another piece of work that's being done within that Digital Learning Solutions tool is around self-assessment, around competency frameworks. More and more areas are having competency frameworks developed, and historically these have been done in paper format or PDF format, being more realistic about it. And what these will do is define a series of skills or competencies or other kind of possibly curriculum statements or that kind of thing that staff may need in order to deliver their jobs, to a high standard. It'll be broken down by level so that as a member of staff gets more senior or progresses in their career, they'll need to have certain skills either at a higher level or they'll need to acquire new, different skills. These competency frameworks also work in a matrix style. So rather than just one individual and the skills that one person may need, across a team you need a mix of skills. If one person is good in a particular thing, then the next person doesn't need to. They can have complementary skills, if you like. So the competency framework tool will allow a central framework to be developed, tailored to local level if required, to cope with the particular intricacies of that particular team and the skills mix there. All the various statements or competencies that are defined, they'll have learning associated with them. So a member of staff can see that I need to get better at handling patients with dementia. So they can say, okay, that's a skill I'm okay at now, I can self-assess, I'd like to improve. Okay, here are some learning resources that will help me do that. So I can click on the link there, get automatically taken across to some learning, which may be offered by eLearning for Healthcare, or maybe a face-to-face event offered within the local organisation. But it enables me easily to acquire the learning and the skills that I need to better deliver patient care. I think that's a real way forward of bringing everything together, to put the user in control of their own learning journey and find the content that's relevant to them at the right time as easily as possible. So that's Digital Learning Solutions. I'm now going to move on to the eLearning for Healthcare Hub. The eLearning for Healthcare Hub, I was part of the team that's devised and managed this for a number of years, so this is kind of something I know very, very well. The eLearning for Healthcare Hub has been live for around 6 or 7 years. In that time, it's gathered, I think, 1.8 million users across the health and social care system, and it goes beyond, because the library of content we have on the eLearning for Healthcare Hub is vast. There's content, for example, around enabling people that work with children and young people to spot signs of poor mental health. So in that kind of project, the teaching community is a key audience. So the eLearning for Healthcare Hub doesn't just cater for the NHS workforce or social care. It goes beyond to anything that can help deliver better health outcomes across the country, really. So all the content on the eLearning for Healthcare Hub is available free of charge. And there's, I think, 400 roughly different programs of learning. They can vary in size from something quite small and niche to our coronavirus program, which is thrown together really quickly, but it's over 1,500 different learning resources aimed at helping the workforce respond to the pandemic when it broke last year. There's a range of content, as I'll talk to you about it in due course, but it's important to recognise the need that this fills and what it's been trying to do for a number of years. It's been very, very streamlined around the delivery of e-learning content. That content has been put together typically from experts in their field. So if we're doing a project, let's say, on e-learning anaesthesia, then we'll work with Royal College of Anaesthetists, and there's a clinical lead who defines what content is required, breaks that curriculum down into modules, into learning objectives and that kind of thing to make sure there's a good range of content. And then we'll partner up with that clinical organisation, they bring their clinical expertise, to create content that's needed. But it's very much determined by clinical experts and that kind of thing. Streamlined to help users find content organised by experts, and usage has been really, really high over a number of years, streamlined around that one particular goal. So year on year, the amount of usage has grown. In 2019, there were around about 7 million bits of content launched on the eLearning for Healthcare Hub. That was, for us, was a great year. Then, obviously, when COVID came along, face-to-face teaching, training had a massive amount of disruption. Lots of people kind of moved across to digital provision. So as a result, we had 22 million bits of content launched on the eLearning for Healthcare Hub last year, which in terms of value for money per unit of learning delivered, it's really, really cheap. It's a fantastic result. And also, it demonstrates to us that the content we had and the service we offered was being taken up at huge scale by people around the country. We felt we really fulfilled a need there with the eLearning for Healthcare Hub. However, as I say, the eLearning for Healthcare Hub is about 6 or 7 years old now. In internet terms, that's pretty old. We recognise that the eLearning for Healthcare Hub, while it's been a great workhorse for a number of years, it's provided a really great service, it can't keep on forever, it needs to be replaced. So part of our sustainability and longer term planning, the new platform we have coming across will be the will be the Learning Hub. This infographic shows you how successful the ELF Hub has been, or the eLearning for Healthcare Hub has been, in terms of the amount of usage, what people are using, how they're using it. But this is the system that's going to replace it, the HEE Learning Hub. Now, I said that the eLearning for Healthcare Hub is very much organised around the delivery of e-learning content, curated and designed and organised by clinical experts. The Learning Hub is an attempt to go beyond that, to add more functionality, to democratise that ability to create and share content. So where there may be a group of nurses or junior doctors, let's say, in a big given hospital, they may want to record a series of podcasts, let's say, about where the best place to park is on a Wednesday morning, which cafeteria is the best on a Monday when this particular patient group comes in or something. Those people can create that content, whether it be clinical, whether it be kind of helping people just get on in their work lives. They can upload it themselves into the Learning Hub. So all that great clinical content put together with the relevant clinical organisations or professional bodies, that will all exist as well. But alongside that, it'll be augmented by content created by the workforce at large or other organisations and that kind of thing. So it's a different way of looking at learning, adding new strings to the bow that the Technology Enhanced Learning team can offer. The various different sorts of resources in there could be any number of different things. Chris was talking before about augmented reality and extended reality and virtual reality. When people are creating content in those ways, then all that content can be uploaded into the Learning Hub for others around the country to share. So it gives that equity of access that Chris was talking about. It can also be much more low-tech. It could be a Word document with a series of simulation scripts related to somebody in a simulation environment, or it could be high-quality e-learning content, peer-reviewed and published and accessed by a number of people. So the Learning Hub we were aiming to be is the one-stop shop for all digital learning needs in its kind of way. It will also have content created by the workforce, but by content created by experts. It will also have the capability of tailoring content and experiences to specific audiences. And this is something we're working on at the moment with Royal College of Pathologists. Pathology slides can be huge in terms of file size. They can be 2 gigabytes for a single image, which obviously on the internet is quite difficult to manage. So we're building a tool to enable people to view those huge slides on a typical machine specific to pathology. The ability to go in, practice interpretation of slides, identifying abnormalities with a proper slide viewer, which you can see on screen there. So this uses similar technology to Google Maps, actually. A huge 2 gigabyte image gets uploaded. Our system then processes that image, slicing it down into a series of smaller tiles. Then the user can view each one of those tiles, zoom in, zoom out, rotate it, annotate it, and each small individual tile gets used as needed. So rather than the user downloading this one enormous file, they'd only get the bit that they need. This ability to have easy digital imaging of files of that kind of size isn't something that we're aware of elsewhere. So this is an example of the Technology Enhanced Learning Programme responding to a need of a particular audience with a high-tech solution that's going to meet their specific requirements. Obviously, once we do this for pathology, other imaging specialties such as radiology, radiography, or dermatology could also benefit from this technology. So we're always looking for that kind of wider application as well to deliver best value for money. I think this slide view is something we've been working on really recently. I think it's a really good example of our team working with clinicians, understanding their needs, and delivering a technology product that just fits the bill. It's a really, really good piece of work. I really like it. So that's the platforms that we have, the Digital Learning Solutions, eLearning for Healthcare Hub, and the Learning Hub, which is the new one where all our strategy is being directed and our energies are being invested. But all those platforms, they need to host content. So where does that content come from? As I've said on the Learning Hub, that content could come from other organizations or individuals around the workforce. But also we have a function to create that ourselves, which is the eLearning for Healthcare team. So the e-learning for healthcare team have created over the last, I think, 15 years or so, tens of thousands of individual learning objects. As I say, there's a huge library of content, hundreds and hundreds of learning programs. The first programs we worked on back in the dawns of time, it feels like to me, were aligned to Royal Colleges and their specialty-based curricula. So Royal College radiologists was the first, anaesthetists, general practitioners, sexual reproductive healthcare and that kind of thing. Those are our first really big projects. But over time, that range of content has spread. We have loads of content aimed at the social care sector, aimed at the public health sector and that kind of thing as well. So we have content, we think, aimed at almost any member of the workforce. And all, as I say, available for free. And particularly now, or as time has gone by, the NHS used to be this kind of one workforce, quite easy to say what is the NHS and what isn't. It's much harder to make that distinction now. So, for example, some imaging units may have been spun off to make private companies now, but they still deliver services to the NHS. As far as we're concerned, all those people can all access for free. If you're delivering patient care and involved in that provision of care for patients, this content's there for you to help you deliver better patient care ultimately. Now, these are some examples of some content we've created. It's Dementia Week at the moment, so there's some content on living with dementia, which will take people through various case studies and understanding how dementia works, what it means for patients, and how to handle them more easily. There's a case a while ago where there's a government commitment to deliver 100,000 people being educated in what dementia meant, and they came to e-learning for healthcare to help achieve that throughout the reach of our platforms and the high-quality content that we create. Another thing we do a lot, which gets used really, really heavily, is around statutory mandatory content. Every member of the workforce looks forward to it every year, the day they've got to their stat and man content. This is the easiest way they can do it through the e-learning for healthcare hub. This is the thing that employers have to demonstrate their staff are competent in things like safeguarding, data security awareness. Those sort of boxes that have to be ticked, we make it as easy as possible to tick those boxes. And that content of ours gets used hundreds of thousands of times every year. As I mentioned before, the e-learning for healthcare team put together a huge resource of a huge suite of resources, aimed at responding to the pandemic when it broke last year. We formed a clinical reference group with representatives from all kinds of different organisations and different specialties to make sure they were all represented, gathered together some content we already had, let's say, from our intensive care medicine programme, which is very relevant, some of the respiratory stuff that we already had, but also we curated content from the Infection Prevention Society, the British Medical Journal, and places like that, to create this huge suite of resources, which was used millions of times in the last year. For us, I really felt the team stepped up at the right time, really played their part in responding. So, yeah, for me personally and professionally, it's something we're very, very proud of. Care certificate is one of the things we have aimed slightly more at the social care sector. Again, huge uptake, really good engagement with that, about how people are using it in their own location, the way it's tailored to their specific needs and that kind of thing. And again, a massive project for us in terms of reach and usage. The interactive townscape there is something we do for all our health programme, again aimed at the public health audience and understanding how different aspects of life and different places you may go to can have an impact on your public health, or your health, and those around you. And the last one, just bringing up there, is our vaccination content. Again, this is where I think we've played a part in the response to COVID. Our e-learning content isn't the only training that people need to have in order to stick a needle in your arm to deliver the vaccine, but it's a key part of it. There are local requirements as well. But the way the team has responded to clinical need and so on in that regard, it's been fantastic. Okay, and that's me. I can see my time is running out, Sally, so I'm going to hand back over to Chris just to summarise.
Thank you. Cheers. Could we just go back? Yeah. So what we've done today is just giving you a kind of flavour of what HE-Tel does. What we are, this is sort of starter for 10, if you like, but what we're really excited about is running a health and care education track, whole-day track, at the main Giant event in November, December this year, and we hope to see as many people there, thousands and thousands of people, and we hope to be able to put on a really fantastic day for people who are interested in this stuff. So that's it from us. We do encourage you to keep in touch with us. We have a Twitter account, which is up there. And if you would like to subscribe to our monthly newsletter, just email us, and Alex at the back there will be happy to add you to our mailing list. So that's it from us. I hope you found that, if not enjoyable, at least informative.
Thank you so much. That was amazing. Really, someone who is interested in education, I found that inspiring. You've done so much great work, Chris, Martin. Do you have any questions from the audience? If you have, raise your hand, and a microphone will appear from somewhere. Please do try to think about something. While we're thinking about that, I'd like to ask a question. The pandemic has shown us things that are done differently, I guess, virtual learning, etc. What's going to be sticking for us going forward, Chris, from that learning last 12, 14 months from your perspective?
Well, there's a lot of bear traps in the way, not least of which is I think the technology isn't quite there yet, particularly for you and I would know this as surgeons, there's still some way to go there. But people are working on this. There's an enormous amount of enthusiasm. And if I'm going to be honest, I would say the problem is we're trying to squeeze new stuff into old-style training and education. The training and education and the way in which we deliver it has got to change as the technology changes. That's what, and I'm talking medical reform is really important.
Martin, the EHub sounds amazing. Fantastic. I'm so looking forward to it. When's the launch date for us? When can we join it?
So the Learning Hub itself is actually live now. It's still limited in terms of functionality at the moment. We'll be releasing more over time using agile methodologies as dictated by the Government Digital Service. New functionality, new features being released all the time.
And so people can actually upload and crowdsource their own learning.
Absolutely,
is that right?
Yeah.
That's so forward-thinking. So you can have TikTok on there, Instagram on there. What's the plan?
Can do, yeah, anything at all. We're quite agnostic to file format.
Yeah.
So anything you want to upload, you can link out to other resources that you may have posted on other platforms, that kind of thing, or upload the video itself. So yeah, as far as we're concerned, if you think it's learning and you can bring it up there, great, get it on the platform. If there are safeguards in terms of the wisdom of crowdsourcing it, and things can be flagged if they're dangerous or kind of inappropriate, and that kind of thing. So there are kind of safeguards, absolutely.
So there's a mechanism of checking whatever's loaded at some point, right?
That's not a burden we take ourselves, but that is something that we get people to look at. Okay. And we rely on the cream will rise to the top. The best content will be sourced, the best content will be available.
Wonderful.
That'll be presented to the workforce.
It's world class, it really is. And how about taking it globally? I mean, this is such an amazing resource. And it just doesn't do well using its gravitas globally. But this is amazing, right?
Yeah, I mean, I think in terms of global reach, one thing, it's actually my favourite stat of probably my working life really, is the coronavirus program that we put together. We made that available for free worldwide. Looking at Google Analytics, that's been accessed by 130 different countries around the world. There's only 185 countries listed in the UN, so fully 2/3 of the countries of the world have accessed the learning that we made available for free.
Wonderful.
So in terms of global reach, yes, absolutely, it's out there. We feel we've played our part there. So yeah, I'd like to think we tick that box pretty well.
What an amazing achievement. Any questions, guys? Any hands raised? I can't see any. Don't be scared about getting the microphone in your hand and transferring COVID from patient to patient. Don't worry. We'll leave it at that. I'd like to thank HEE for being a great sponsor and supporter of Giant over many years. We look forward to welcoming them into our main event in December, where hopefully we'll see some amazing tech being used and all this being launched. Chris, Martin, thank you so much.
Thanks, Shafi.
Right, at the beginning, we talked about AI as one of the key technologies that are going to power health in the future. And it's had a lot of trials and tribulations. We had the immense kind of hope for many years about what it could possibly change for us. There's enormous hype, of course, about the use cases. And now we're seeing a sense of reality. We're seeing real use cases in real time. And 2021, for me, is going to be changing the way AI is used in healthcare, whether it's in diagnostics, whether it's used in treatment, whether it's used in drug discovery, many things that AI might be used for. One of the global experts, we're lucky to have him in the UK at Moorfields. He's an ophthalmologist called Piers. Piers Keane has been working with Google DeepMind, which I'm sure you've heard about, on looking at OCT scans, looking at AI on images in ophthalmology. And there's a number of papers in